If you've been told that osteoarthritis or degenerative disc disease in your spine is inevitable, that it's natural with aging, and that there's nothing you can do about it, stop right there. There is new cutting-edge research and new healthcare technology that most doctors don't know about that shows that osteoarthritis can actually be reversed. This is possible without surgery, without drugs, and without injections. That's right, I'm talking about an actual increase in disc height as shown on pre and post x-rays. In this video, I'm going to show you exactly how osteoarthritis occurs, why it's reversible, why most doctors don't know about this, and the exact new healthcare technology that has repeatedly shown reversal, helping many to finally find long-lasting relief from their chronic debilitating back pain and neck pain. Stay with me to the end because I'll show you your best chance of avoiding surgery and getting back to living your life. Hi, I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. So what exactly is osteoarthritis of the spine? Well, there are over 100 types of arthritis. Osteoarthritis is the most common. Whether I use the terms osteoarthritis, degenerative disc disease, degenerative joint disease, spinal deterioration, spinal decay, they all mean the exact same thing. It's a wear and tear of the discs in between the vertebrae, and in fact the vertebrae themselves as well. So think you've got vertebrae, you've got disc, you've got vertebrae. The disc acts as a cushion in between the two vertebrae. The biggest thing that it does, though, is it provides space for the nerves to exit through those openings, or what we call the foramen. So obviously we want these nice thick disc spaces. Unfortunately, in osteoarthritis, you get a wear and tear of that. And the more that wears and tears, eventually that actually comes where that can fuse together in the end result. Obviously, that's going to put pressure on those nerves, and it's going to significantly limit your movement and your, especially between each individual vertebrae as well. So that's what we're getting, and that wear and tear can come from so many different things, really everyday living. Now, in that everyday living, there are three key things that speed up that degeneration in the disc. So the disc, the outer layer, is what we call an annular fibrosis. More of a fibrous type layer. Inside is what's called a nucleus pulposus. You don't really need to know all of that, but think of it like jelly inside the disc in there. So three things that speed that up. Number one, if I damage that disc, it's going to wear and tear faster. That's not rocket science. So the damage can be what I call fast damage. So those are car accidents and sports injuries and falls and so forth. That damage can be what I call slow damage. So slow damage can be a small amount of pressure, but over a very prolonged period of time. So that's going to be chronic work postures and postural changes and weaknesses and things such as that, imbalances and so forth. The second thing that will speed up that degeneration is a lack of movement to the area. And you're going to say, well, I move around all day long. Well, the reason movement becomes so important is there are no blood vessels that go inside the disc. So the way that that disc gets its nutrition is a big fancy process called imbibition, which means it's movement that pumps the nutrients into the disc. So if there's no movement between each individual vertebrae, you may say, oh, I can turn my neck, and that will pump nutrients. Not necessarily. You may have two vertebrae that aren't moving at all relative to one another. That also speeds it up. The third thing that speeds that up is the body's capable of producing those nutrients. It does that to about age 40, give or take a year or two. So the problem is once you pass age 40, the body's not even producing those nutrients anymore. That's why we tend to see this speed up, not because it's inevitable with age, is because there are three things that are happening that no one is really doing anything about. So given that those are the three things that actually speed up osteoarthritis, doesn't it make sense if we do something to counteract those three things, we can actually stop that progression? Will you ever completely stop osteoarthritis? I mean, no. Eventually, if you live to 200, of course, your body is going to break down. But there are so many things that we can do, and we want to focus on those three things. So number one, we want to correct the damage that was done. Number two, we want to restore movement to each of those individual vertebrae. And number three, we want to get those nutrients back into the body. If we do all three of those things, then yes, osteoarthritis is very much something that can be slowed down, in a lot of cases stopped. And in our clinic, we are actually showing reversal, where you'll actually see an increase in disc height. But you need to be prepared to do all three of those things. So if that's true, which it is, then why are there not more medical doctors telling you that this is possible? Very simply, they don't know how to address any of those three things. They will give you pills and potions and all sorts of therapy and so forth, But if they're not actually addressing the three underlying causes that cause the osteoarthritis in the first place, then of course they're not going to see the reversal. And certainly it's going to progress. It becomes a self-fulfilling prophecy. One of the things they don't tell you, if you've been involved in a car accident, for instance, is the damage that just comes from the whiplash in a car accident, on average is increasing the degeneration in your spine by about 10 years. So if you're a 30-year-old after a car accident, you're going to have a 40-year-old spine. Even if you walk away pain-free, you need to address these things. So then what is the number one form of care that we use in our clinic to actually reverse osteoarthritis? It's what's called a neurospinal restoration program that looks at the big picture, and specifically within that is something called non-surgical robotic laser spinal decompression. Again, think of all those things, all the things that you've done from stress to injury to postural imbalances over time have caused those discs to actually compress, and then they start to wear and tear. And so first they will compress, they'll thin out, then the body will actually grow what we call spurs or osteophytes. It's actually growing bone to try to fuse you together. That's not a good thing. In our office, by using non-surgical robotic laser spinal compression, what we do is we literally start to decompress that area. It is not the same as traction. It is not the same as inversion. Anyone who tells you that, run out the door. This is so clear in the scientific literature. The difference is in true spinal decompression, you're creating negative pressure in the disc. That's what's necessary to create that vacuum effect that will pull fluids and nutrients back into the disc. That's what you need, those nutrients back in the disc. You need to correct that damage, you need to take the pressure off, and you need to restore that normal movement. If you do all these things, we are literally seeing an increase in disc height pre and post x-ray on our patients in our clinic. To that, we add very specific, what we call neuromuscular re-education exercises to actually get the brain to start using these properly again. We do neurofunctional correction to actually increase that movement in there. We get rid of any scar tissue or adhesion. We certainly have you on a disc replenishment and healing protocol that will then give that body the nutrients to pull back into the disc, especially if you're over age 40 as well. And then we even show you how to prevent some of this from ever happening in the first place. If you'd like to see the clinical research on this, please go to my website at excellenceinhealth.com. Go to the section on non-surgical robotic laser spinal decompression and go right to the bottom. You will see the clinical studies that come directly out of our clinic. You'll see pre and post x-ray, and you will see an increase in disc height. On average, for most of our patients, we easily see a 1 millimeter increase. That's huge in terms of increasing disc height. But for a lot of our patients, they actually see significantly more than that. 77% of our patients saw a better than a 15% increase in disc height. Another 62% actually saw better than a 25% increase in disc height in most of these cases over a 12-week period. You do not have to live with osteoarthritis in the spine. There is new healthcare technology. We know new ways of how to deal with this. Please take advantage of that. If you know of someone who could benefit from this information, please like and share it. Please subscribe. We, as I said, upload a new video every week. Our goal is to help people suffering with spinal issues, low back, neck, chronic pain that they don't need to live with. Please go watch this video next.